Good morning, sir. Everyone here. Good morning. My topic is on risk factors and outcome of post-traumatic endophthalmitis in open globe injury in a tertiary care hospital. I am Anshu Jameer. No financial interest in this. Post-traumatic endophthalmitis is a severe complication of penetrating ocular trauma. It occurs in 4 to 16% of open globe injury and represents 25 to 30% of all cases of endophthalmitis. Ocular trauma, particularly open globe injury, is one of the major causes of acquired visual loss in all age groups. Poor visual outcomes can be determined by mechanism of injury, virulence of microorganisms, diagnosis and initiation of treatment, association of intraocular foreign body or lens rupture, and large wound size. Early wound closure with intravitreal antibiotic treatment may improve visual outcome. To evaluate the incidence, risk factors, and outcome of traumatic endophthalmitis after open globe injury in a tertiary care hospital was the aim of the study. This was a retrospective study done in Rio Rims, Ranchi between 21 to May 23, and this study was conducted in accordance with the tenets of the Declaration of Helsinki. Patient data, injury details, clinical presentations, and visual outcomes were collected. Details of globe injury, including laterality, initial visual acuity, anterior and posterior segment abnormalities, and imaging investigation B scan were assessed. Presence of endophthalmitis was determined by using clinical symptoms and signs: eye ache, redness, deteriorating visual acuity, purulent discharge, chemosis, edema, hypopyon and fibrin in AC, anterior chamber, and vitreous opacification. Written informed consent was taken from all the patients. The patient presented with endophthalmitis or at high risk of infection, intraocular foreign body, or delayed presentation were treated with intravitreal vancomycin 1 mg per 0.1 ml and ceftazidime 2.25 mg per 0.1 ml. Patients who had fungal infections, intravitreal amphotericin 5 microgram per 0.1 ml were given. Use of intensive topical antibiotics, steroids, and oral systemic antibiotics depended on the severity of infection and associated ocular injuries. Surgical management, including pars plana vitrectomy, were reviewed. Microbiological results for both aqueous and vitreous sampling and culture were collected. All the data were noted on MS Excel sheet and analyzed. 17 patients with mean age 38 plus minus 2.5 years were included. 12 patients had signs at the initial presentation. All 17 patients were given single dose of intravitreal vancomycin 1 mg per 0.1 ml and ceftazidime 2.25 mg per 0.1 ml. In 7 eyes, PP was done and intraocular foreign body were removed in 2 eyes. The visual outcome was improved in 8 patients, unchanged in 13, it changes automatically, sir. And worse in 6 patients. 53.3% had delayed treatment with more than 24 hours after open globe injury, and 37.5% out of these 9 patients had a poor visual outcome. These are the clinical findings I came across. Conjunctival hyperemia, corneal edema 11 cases, creative precipitate hypopyon, fibrinous membrane, vitreous debris in 10 cases, and absent in 7 intraocular foreign body, 2 and some cataractus changes were seen in 3 patients. Visual outcomes of post-traumatic endophthalmitis cases. These are the outcomes: Conte figure, hand movement, PL and non. These are the pics. So these are the B scan showing the echoes in the vitreous debris. The discussion: the risk of post-traumatic endophthalmitis is associated with anterior wound location, presence of intraocular foreign body, and delay in primary wound closure. It is often associated with poor visual outcomes compared to other types of endophthalmitis. The reported incidence of endophthalmitis following open globe injury ranges from 3.1% to 11.9% in the absence of intraocular foreign body. Incidence of cases with intraocular foreign body ranges from 3.8 to 48.1%, with higher infection rate reported in eyes having retained intraocular foreign body contaminated with organic matter. Conclusion is early repair with intravitreal antibiotics treatment and PPV with contaminated intraocular foreign body removal may salvage visual outcomes, and patients with delay in primary repair, ruptured capsule, intraocular foreign body, infected wound with organic matter had a high frequency of infection. These are my references. Thank you, sir.
Thank you. One question: how do you find what is difference between your study and the study done previously on the post-op endophthalmitis cases?
Excuse me, sir, which study?
There are a lot of studies done on the similar type of things, means post-traumatic endophthalmitis. So do you find any difference between your study and another one, or in the literature which is published already?
There's not much difference, sir. There's nothing I can say, but it's almost somewhat.
Sir, just what you would like to propose from your study means you have done this study, then there's some objective or something you would like to suggest.
We
that
noted in our study that if it is the early surgical repair is done within as soon as the patient comes up within 24 hours, we are getting the less cases of traumatic endophthalmitis. Sir. This
Okay,
is
means
and
okay. Thank you.
early
Ma'am.
repair.